The Multicultural Health Communication Awards were established back in 2003. They're coordinated by the New South Wales Multicultural Health Communication Service, and I know that that team does a mighty job, a magnificent job, and I know just how hardworking they are, and it's always so great to work with the team. So Jess and your team and Gaia, everyone, thank you. And as I said, how wonderful to be here in this magnificent building, the New South Wales State Library, in person. It's been too long. Lovely to see all of your smiling faces. And a big hello. I'll just wave to the cameras in the back. Hi to everyone kind enough to be tuning in with our live stream. Wonderful to have you on board as well via Zoom. Hope you're enjoying this occasion. So a big shout out to everyone online. I want to begin by acknowledging the traditional custodians of this magnificent land we meet on today, and indeed from wherever you're joining us from online. Right here, right now, the Gadigal people of the mighty Eora Nation. I extend my respects to elders past and present and to any Indigenous, Aboriginal and Torres Strait Islander people here today. Thank you. Today we are here to hear from some wonderful speakers. They're lined up throughout this event, and that includes the Secretary of New South Wales Health, Ms. Susan Pearce, who'll be announcing our lucky winners today. For those here in the State Library, we really hope that you enjoy the light refreshments on offer here. I'm from SBS, we're all about food, so I was really, really so happy to see such a great spread here today. Hope you enjoy that, as some of you have already done, including myself. Tea and coffee is available up the back, as well as some water, so please help yourself. I hope you've all enjoyed, as I have, our wonderful musicians here today. Let's give them a round of applause. These fine people are from the Cultural Arts Collective, and the good news is that we'll be hearing more from them, their sweet tunes, right throughout the evening, so it hasn't stopped yet. So thank you so much, though, for that beautiful introduction to the event. So wonderful to have you with us. Now, before we proceed, just a little bit of housekeeping. Please put your phones on silent. It doesn't mean you can't use them. We love you, in fact, to engage, to take photos, to share it with all of your friends and your colleagues, our magnificent nominees and award winners today. They deserve a shout out. We just don't want to hear any phones going off through the morning. So go ahead, take as many photos as you like, really. We encourage you to do so, but I would like you to promise me that you're going to share the photos with all of us. So share your comments, your posts with the Multicultural Health Communication Awards team. So the hashtag is #Multicultural Health Awards. #Multicultural Health Awards, pretty easy to do. Just tag all your photos, and that way we can stay connected and see what everyone else has been up to today and spread the word about these awards. You can do that on the New South Wales Multicultural Health Communication Service social pages, Facebook, Twitter, LinkedIn, Instagram, as well as WeChat. Whatever platform you choose, we'd love to check it out. We also have official photographers and videographers here today. They'll be capturing the moment, taking photos throughout the awards presentation this morning. Now, if you have issues with that, if you don't want your photograph taken or videoed, not a problem, but just let someone from the Multicultural Health Communication team know. They all have little badges on, so pretty easy to find. The toilets are located just through these doors here, very easy to find, and in the unlikely event of an emergency, you have to follow these doors. There's only one way out, okay? So it's those doors, toilets, emergencies, that's where we have to go through those doors, but do so in an orderly way. In the unlikely event of an emergency, I'm sure it'll all go swimmingly, okay? I'd like to now invite to the stage Uncle Alan Madden from the Metropolitan Aboriginal Land Council to deliver the official welcome to country. So please join me in welcoming Uncle Alan Madden to the stage.
Thank you. 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 Thank you.
Once again, my name is Alan Madden, Gadigal Elder. For my first song, it's always an honour and pleasure for me to welcome one and all the country. Just to give you a little bit of an insight of where you are and who we are. Married man, 10 children, 26 grandchildren, and 17 great-great. Yes, we did have TV. Just couldn't afford the bloody electricity. Born and bred in Redfern, the capital of Sydney. I like the man. I like the guy. Yeah, thanks, man. As I mentioned, it's always an honour and a pleasure. And the winners are... No, sorry. Firstly, I'd like to acknowledge our First Nations and traditional owners of the lands that you may have come from or work upon, and pay my respects to all our Aboriginal elders, all elders, past and present, also pay my respects. To all our Aboriginal and Torres Strait Islander brothers and sisters, from whatever Aboriginal or island nation you may have come from, welcome to Gadigal. And to all our non-Indigenous brothers and sisters here today, a very warm and sincere welcome to you to Gadigal. No matter where you've come from, whether it be across the seas, across the state or across town, once again, a very warm and sincere welcome to you to Gadigal. And as I've mentioned many times before, was, is and always will be Aboriginal land. Only three things shorter than that: coming, taxation and going. It's an honour and pleasure to be here today to welcome one and all to Gadigal. Gadigal is one of 29 clans of the Eora Nation. The Eora Nation is bounded by nature's own, the Hawkesbury River to the north, Nepean to the west, and Georges River to the south. And in between those three mighty rivers is the Eora Nation. And in that nation, there are 29 clans. And the clan's land we're on today is Gadigal. On behalf of members of the Metropolitan Local Aboriginal Land Council and of the Gadigal mob, once again, a very warm and sincere welcome to you to Gadigal. There's an old Aboriginal saying out there, and I think it's very appropriate for you mob here today. They say, where there's a will, there's relatives. And as you travel across these traditional lands and waters, may the spirits of our ancestors guide, look over you, and keep you safe. So once again, on behalf of the Land Council and of the Gadigal mob, welcome, welcome, welcome. Thank you.
Oh, gosh, thank you so much, Uncle Alan Madden, representative of the Metropolitan Aboriginal Land Council, for that magnificent welcome to country. Yes. We are all in awe of the amount of people in your family, Uncle Alan. Congratulations. Next time you must reveal your skincare routine, because we don't understand. We cannot do the maths on that one, but thank you once again. How lovely to have such a wonderful welcome from Uncle Alan. It's always such a very moving and beautiful way to start these sorts of events. I'd like to now call to the stage Miss Oriana Acevedo to welcome everyone here today to this magnificent New South Wales State Library, our host for the awards this evening. Oriana and the State Library team have been long partners of the Multicultural Health Communication Service and have been promoting multilingual resources and programs for many years, so we deeply appreciate their support. Please put your hands together for Ms. Oriana Acevedo.
Thank you, Janice, and welcome everyone. You all look fabulous. To the photographers in Zoom, don't dare to take the double chin. It just doesn't exist. On behalf of the State Library, I would like to welcome you all. And before we begin, I wish to acknowledge the custodian of this land, the Gadigal people of the Eora Nation, and the elders past and present. I acknowledge the first Australian as the traditional custodian of the continent, whose culture are among the oldest living culture in human history. I acknowledge and respect their continuing culture and the contribution they make to the life of the city and region. It was really interesting because every time that I hear a welcome to country, I learn something. And so today was interesting about the 29 tribes. Is that okay? Yeah, okay. So on behalf of Dr. John Valens and the Library Council, I am delighted to welcome you at the State Library of New South Wales, the State Library that was built on Gadigal people. I would like to welcome Mr. Toby Wilson, the Chief Executive of Southeastern Sydney Local Health District, where I live. Ms. Lisa Woodland, where's Lisa? Lisa is here. Our friend, Director of the Multicultural Health Communication Service, and Ms. Susan Pierce, Secretary of New South Wales Health. First of all, I would like to thank you all for your work, for your support to our communities, for providing key information and resources to increase opportunities to contribute and participate in all aspects of public life. Why? What else do we have if it's not health? If we're healthy, if we are well informed, then there's a big spectrum of possibility in our life. The State Library provides consultancy and advisory services through 369 public libraries across the entire state. We develop programs and work with public libraries and welcome communities, including the new arrived and the refugee. We also have collections in 42 languages. This year, we launched the Tagalog collection. And by March next year, we hope to have probably the only Tibetan collection in the country. Why collections are important, and this is something that I really, really want you to remember. In our collection are for fun. Fun helps us to maintain a healthy mental health. We are migrant, I am, and sometimes our network are not that as extensive. After our network kind of tend to disappear, we need to keep in touch with something that keeps us active. And that's when the fun books are. Some people might like detective stories, some like romance, some like to read history. That's what we have. Our collections are in total about between 65,000 to 70,000 items. They travel for free. It's one of the unique services in this country. It doesn't matter where you are. What is also important, because the collection have a part that is non-fiction, that's where health is. And so we think about it. If I go to the doctor, sometimes my doctors are so busy. If I want to see somebody who speaks Spanish, it's tougher, and we know that. But if at least have some preliminary information, I know what to ask. Sometimes we go to the doctor gives us the information, it's a big thing to process, we go home, and only then we think what question we can ask. Our collection here at the State Library, all of them have basic, generic information on health. The information that you provide is absolutely fundamental for our service. And that's our business, information. So please don't forget that we are your friends. Public libraries are your friend. The door is always open. If you have to deliver a program, we're there. And we have the network. You need to send information to reach out, you find me. There's only one Oriana. It's good not to be called Jane or, or Maria. Only one Oriana, you will find me. And that information will instantly go to 300 and something libraries in the entire state. The other announcement that I want to make is we've been friends and partners for a long time. And Jess is a fabulous person, and the team, I love them all. It's all about love. Anyway, on the 22nd, which I think is tomorrow, is it? Yeah. We are going to launch the National Multicultural Group under the banner of the Australian Library Association. Now, that's about training and bringing up people who will continue providing services for the multicultural community. It will lobby, it will have a voice, and try to provide the services, whatever it is that the community needs. But at the same time, multicultural health information has fabulous resources. And so the first thing, because I'm in charge of developing the sharing of resources, I put the link, because then if an individual working in a library anywhere in the Southwest and say, you know them, they're looking for information on diabetes, the most common thing, and they think that the only access to information that they have is in English. But it's not. That's when we train librarians across the entire country to say, no, there are also information in multiple languages that have been checked and rechecked, and you can do that for your clients. So that's why you are now being exposed to through the ALIA, the Australian Library Association. That's where the link is, and we will try to collect information from other states. So I wish you now all the very best for the future. I wish you stay healthy and happy and continue being friends with us, and always tell us what are you doing that we can disseminate for the good of everybody in our community. Thank you so much, and I hope that you will visit us one day, just for the heck of coming to the city, okay?
Thank you so much, Oriana, for that wonderful address, and also for extending the hand of friendship. I think we all definitely got the message. That's very, very generous of you to make that very clear to us. And I loved that you told us it's all about love. We can all take that with us when we go out the doors here today, but so lovely to share that with us. And we know that we have a friend in you, at least here at the State Library, so careful what you wish for is my advice to you, but we really appreciate you being so generous and so very friendly. Well, to officially kick off today's awards program, it's my pleasure to invite to the stage Mr. Toby Wilson, Chief Executive, South Eastern Sydney Local Health District. Please join me in welcoming Mr. Toby Wilson.
Thanks, Jennison. Thank you for your ongoing support for these awards. It is really appreciated. Good morning, everyone. I'd just like to also thank Uncle Alan for his welcome to country and acknowledge the traditional custodians of the land on which we're all gathered today, the Gadigal people of the Eora Nation, and pay my respects to elders past, present and emerging. It is my great pleasure to welcome you here today for the 2022 Multicultural Health Communication Awards. I would like to thank all of you for joining us today to celebrate these awards, and especially to those online as well that have joined us to watch the telecast of what we're presenting. This really is a showcase of some of the outstanding multilingual health communication and resources available across New South Wales Health and health-funded non-government organisations. A thank you to Susan Pearce for joining us today, the Secretary of New South Wales Health. It's great to have your support. And a big congratulations to the team. 19 fabulous years of handing out these awards. It's a huge effort, and I'd really like to acknowledge Lisa and all of her team for the effort that they put into this every year in coordinating these awards, and we'll hear from Lisa shortly. These awards celebrate the work that's undertaken to engage and inform culturally and linguistically diverse communities around health and wellbeing. We know from the census in 2021 that around 2.2 million residents in New South Wales speak a language other than English at home. That's more than any other state or territory in Australia. And that represents about 1 in 4 people across New South Wales. And for Greater Sydney, that's 1 in 3 people. The top 4 languages are Mandarin, Arabic, Cantonese, Vietnamese, but we are seeing significant increases in the number of people that are speaking Filipino, Tagalog, Hindi or Nepali. And we know that for many of these people, these communities, they have low English language proficiency, and therefore they rely on language support in the form of interpreter services and translated health information. So the services that we're celebrating today are absolutely essential for us to be able to inform the literacy of these communities. By increasing the health literacy of both individuals and organisations, we can improve access to our services and the quality of the care that we provide for culturally and linguistically diverse communities. In response to the COVID-19 pandemic, we've seen how so many staff across New South Wales Health have gone above and beyond to keep culturally and linguistically diverse groups aware of what is going on and informed of the information. And you'll see from so many of the nominations today and our finalists today, the incredible initiatives that have been able to be rolled out during this time. It's also great to see so many examples where we've been able to work across other government organisations and other groups to spread the message more broadly than just within our health services. Close partnerships have formed in the last 2.5 years between the local health districts, multicultural health services, media and communication teams, Multicultural Health Communication Service, the Ministry of Health COVID-19 Communication Team, Multicultural New South Wales and the Department of Customer Service. These examples really do highlight the way that we can all work together to spread the word and get the information out to some of those communities that are most difficult to reach. And these awards today provide us with the opportunity to celebrate these partnerships and the incredible work that is undertaken across New South Wales Health for culturally and linguistically diverse communities. So I'd like to congratulate all of the finalists. Thank you, Janice.
Thank you so much, Toby. I think you've made it so clear just how much respect and admiration we have for all of you in the room today, and especially everyone who's been nominated. So again, thank you. Thank you so much for your hard work in keeping all of us safe. And many thanks again, Toby, for those generous words. Really, really appreciate that. I'd like to now introduce our next speaker, a familiar face, I hope, to all of you. She leads the hardworking team at Multicultural Health Communication Service. Lisa Woodland is the Director of the service, as well as the Director of Priority Populations and Health Promotion at South Eastern Sydney Local Health District. A very, very busy person. It's wonderful to have her here as always. So please make her welcome. Hands together for Lisa Woodland. Thank you.
Good morning, everyone, and thank you very much, Janice. I'd also like to acknowledge the traditional custodians of the land and pay my respects to Aboriginal elders past, present and emerging. I'd also like to pay my respects to people from migrant and refugee backgrounds who've come from all around the world to make Australia their home and to contribute to our rich multicultural society. I'd like to acknowledge our special guests who have joined us today and warmly thank Susan Pearce for being here to present the awards. Thank you. Thank you very much, Toby, for your ongoing support and the support of South Eastern Sydney Local Health District for the Multicultural Health Communication Awards. The awards, which were previously held every 2 years, have now been made an annual event. And this provides us with an opportunity to recognise in a more timely way excellence in multicultural health communication across New South Wales. To our colleagues in the ministry, a sincere thank you for all your invaluable support for my team as we coordinate these awards. To all our colleagues across New South Wales Health, thank you for your passion and dedication in working with culturally and linguistically diverse communities. To the finalists, thank you for taking the time to submit your applications and helping to showcase best practice in multicultural health communication. This is so important as we know that many people from culturally and linguistically diverse communities experience significant language and cultural barriers in accessing health care, and that they are at greater risk of poorer experiences of care and poorer health outcomes. This is what we seek to address. We know that it's crucial for health services to respond to people's language needs through the provision of professional healthcare interpreter services and translated health information to empower them and to make informed decisions and be partners in their care. I, like many others in this room, have been working in multicultural health for many years. The silver lining of the COVID-19 pandemic has been to reinforce to our politicians, to our executives, to our senior managers, and our colleagues across New South Wales Health the importance and the centrality of working with multicultural communities if we are to achieve population-level health outcomes. To our judging panel, thank you for your time and expertise in judging the applications. Our magnificent judges this year were Amanda Stevenson, Director, Public Health COVID-19 Communications, New South Wales Ministry of Health. Thank you. Ashley Young, Manager, Multicultural and Refugee Health, Hunter New England Local Health District, up the back. Dana Muad, the Program Lead from Western Sydney Local Health District, Strategic Partnerships and Programs, Sydney Health Literacy Laboratory and Hub. I'm not sure whether Dana's able to join us today. No. Nadia Bekarian, Head of Business Development, Special Broadcasting Service in Language. Thanks, Nadia. And Sue Advani, Community Representative and President of SIVA International, a community organisation representing the South Asian community. Thank you, Sue. To my team at Multicultural Health Communications Service, I thank you all for your support and the enormous work you've done behind the scenes. And I'd particularly like to acknowledge Gaia Dharmagasan for her outstanding efforts in coordinating the awards. Thank you, Gaia. So we're very proud to be able to showcase the exemplary work of services and individuals in this year's awards. I hope you enjoy the event this morning. Thank you very much.
Thank you so much, Lisa, for those generous words as well, and indeed to the Multicultural Health Communication Service team for your passion, your dedication. I know these things don't happen overnight, so we really appreciate the hard work that you've put in. Thank you so much for delivering these awards. And can I say it's a masterstroke that you've decided to hold this annually. So to Lisa and the team, whoever decided to do that, thank you, because we love celebrating all these people in the room today and all of your team members, anyone who couldn't make it. Well, now it's my great pleasure to introduce to the stage our guest of honour, the Secretary, New South Wales Health, Ms. Susan Pearce. We are truly honoured to have her here with us today to announce the winners of the Multicultural Health Communication Awards 2022. So please join me in welcoming Susan Pearce.
Well, thank you, Janice, for that lovely introduction. Also, Oriana, thank you for welcoming us here to the State Library and showing us the love. God knows we all need a bit of love after the 3 years we've collectively endured. Could I also thank Uncle Alan for his always entertaining welcome to country, pay my respects to elders past, present and emerging, and acknowledge that it was and always will be Aboriginal land. Toby, thank you for having me. I'm absolutely delighted to be here. And I wasn't going to mention COVID, but since Lisa mentioned it, I will follow suit, because I think we're all thoroughly sick of talking about COVID. I don't know if that's just a reflection of how I feel about it, but look, what can I say about the response? You've heard how many people within the community here in New South Wales are from multicultural backgrounds. It was so important for us during the pandemic, and particularly during the vaccine rollout, to engage with and work with multicultural groups and organisations. And I'm very proud of the efforts of this whole state, and I would like to thank every single one of you here in this room who no doubt contributed to that effort in some way. We were determined to leave no one behind. But what became apparent to us very quickly was that we could not do that alone, and we needed culturally appropriate messages to our very rich multicultural population here in New South Wales. And to have achieved now over 96% double dose vaccination across this vast state, I think it's fair to say we did a pretty good job. So a round of applause for everyone in the room. I'm not going to talk for too long because I think we need to get on with the winners here, and I'm happy about that drum because I think we can have a few drum rolls. What do you reckon? There we go. Can I thank the Multicultural Health Communication Service for coordinating the program. Great to hear that this is happening every year, and certainly you have the absolute commitment of New South Wales Health to achieve better health outcomes for people from culturally and linguistically diverse backgrounds. The finalists, congratulations to all finalists and to all the teams who've contributed to the work that has led us all here today, and for providing health information that increases health access right across the state of New South Wales. I'd like to commend the excellent work, as I said, of all the finalists in developing and promoting health information. We want people to have control over their own health outcomes and to make the decisions that are right for them. So I think without further ado, Janice, let's get on with it and start announcing those winners. Thank you.
Thank you so much, Susan, for those inspiring words. Again, appreciate you being here with us. But it is time to present the finalists, and the Secretary will kindly stay with us to announce the winners. So before we start the awards presentation, just a little bit of instructions from me to you to make this as seamless and smooth as possible. So we'd like to request that the finalists choose two people from your team to come to this side of the stage when your category's announced. Our photographers will then take official photos. They'll be made available on the Multicultural Health Communication Service website and also the social media platforms that we mentioned a little earlier. So appreciate your cooperation on that front. Are you ready? Here we go. Okay. Let's start with the category Keeping People Healthy. And the three finalists are, firstly, Cancer Institute New South Wales for the Staying Well and Preventing Cancer Multilingual Flip Charts. The second finalist for this category is Transcultural Mental Health Centre for supporting refugee communities with good sleep and stress management. And the third finalist is the Western Sydney Local Health District for Westmead's Women's and Newborn Health Multicultural Support Pages and Resources, empowering women for better health outcomes. So we're just about to watch a video, so I'd like to request that, remember, two people from your team, from those finalists from that category, come to this side of the stage and just pause there for a moment while we watch these videos.
One in three cancers can be prevented by supporting people to make healthy living changes such as healthy eating, being active, quitting smoking, avoiding alcohol and having regular health checks. This is great news that we at the Cancer Institute New South Wales wanted to share with multicultural communities. We asked for help to develop a community education resource from our long-standing partners, Sydney Cultural Support Program from the Sydney LHD and Western Sydney and Southwestern Sydney LHD bilingual community education programs. Together, we created a community education flip chart that told a hopeful story about how to stay well and prevent cancer and where to get further information and support.
It was really important that our cultural support workers were involved in the development side of the community education resource. They were able to provide cultural and linguistic input just to ensure that the images and the text were culturally appropriate. Our cultural support workers reviewed the translated material to ensure that messages weren't lost and also that the information was clear for their communities.
And the Institute has funded community education workshops using the flip chart that are being led by bilingual community educators across New South Wales in 2022.
Our lovely Mongolian-speaking cultural support workers piloted the resource in the community. It was well received and feedback was provided to the Cancer Institute. We were very pleased to be involved in this very important project.
The Transcultural Mental Health Centre works with our partners to protect and enhance the mental health and wellbeing of culturally and linguistically diverse communities across the lifespan and their migration experience.
Informed by community interest and the needs identified across our programs, we expanded our practical guide series, including A Good Night's Sleep and the Stress and Stress Management, adding 6 community languages to the series.
Mental health literacy is particularly low among newly arrived refugee communities, while stigma around mental illness is high. Sleep and stress are issues that affect the mental health and well-being of newly arrived communities, but which hold less of a stigma than mental illness.
TMHC partnered with refugee communities, bilingual clinicians and the Western Sydney Local Health District Translation Service to co-design these resources to ensure that the translated content and visual design were culturally and linguistically appropriate.
These new evidence-based community-tested resources extend the suite of our resources, enabling us to build mental health literacy through responsive clinical and community services and reaching high-need multicultural communities. So it's going to leave a lot of new networks established for our team, so we'll be able to use the resources far and wide.
We developed resources for culturally and linguistically diverse communities at Women's and Newborn Health at Westmead Hospital. Through our website, we added downloadable fact sheets and booklets in language, aiming to help women and their families make healthy choices through pregnancy and beyond. Our research identified the top 5 languages spoken in our local area, and we had the 5 web landing pages translated to increase accessibility. Educational videos and audio were added to the website to help women and their families who may be illiterate.
To improve the experience of culturally and linguistically diverse women while waiting for their antenatal clinic appointment, we developed the Learn While You Wait banner. We found that 61% of women attending our clinic are from culturally and linguistically diverse backgrounds. We also identified that long wait times and receiving inadequate education materials are top of the complaints that we receive. So we looked for a solution to help improve the experiences of these women. Our banner has a QR code system, which is a simple way to direct women to the educational resources in language, thus helping meet their educational needs while waiting for their women's health clinic appointments. We also developed a printed A4 flyer that's available in every clinic room to help our staff provide appropriate health information during their pregnancy visits in language.
So congratulations once again to all of our finalists. As you can see, very strong category, and I know that our judges had quite a time picking a winner. But I will now pass over to Ms. Susan Pearce to announce the winner.
Thank you. How good is it that we're all here together in the room? I like prolonging these things just to build the anticipation. Wears thin pretty quick. The winner of Keeping People Healthy Award is Western Sydney Local Health District, Westmead Women's and
Wonderful, thank you so much. That was terrific. Congratulations to the team from Western Sydney Health. Congrats, that's fantastic. Okay, so that was the winner of the Keeping People Healthy category. Congratulations once again. So, yes, so just hold there, please, if we can. So I'd like to invite to the stage Cancer Institute New South Wales reps to the stage for your finalist certificate. Well done. Congratulations, and I'd now like to welcome to the stage the Transcultural Mental Health Centre representatives to get their certificates. Well done again to our nominees and our winner, and thank you again to Susan and Lisa, but stay poised and ready to pounce because we will continue. Congratulations, yes, to the winner and the finalists in the Keeping People Healthy category. But moving on to our next award now, and it is the Pandemic Response category, COVID-19. There are 3 finalists: Sydney Local Health District and Integrative Cold Community Response to COVID-19 in Sydney Local Health District. The second finalist is South Western Sydney Local Health District for their COVID-19 cold communications from South Western Sydney Local Health District Strategic Communications and Media. And the third finalist is the Western Sydney Local Health District for their Healthy at Home COVID-19 Wellbeing Tip Sheet. And while we're watching the videos, you know the routine now, I'd like to request that the finalists of this category make their way to this side of the stage. But for now, let's watch these videos and see what people in this category have been working on.
Sydney Local Health District population is highly diverse. 55% of our residents speak a language other than English at home. In our COVID response, we quickly identify needs through deep local knowledge and our community partnerships.
We conducted targeted community outreach, establishing accessible, trusted settings for testing and vaccination clinics. We implemented a unique health service delivery model by integrating our cultural support workers and healthcare interpreters with clinical teams to support culturally and linguistically diverse patients' journey.
This informed the development and delivery of a multi-strategic coordinated response, establishing an ongoing collaboration mechanism between our health services and our communities. We produce and tailor 1,500 multilingual resources across 30 languages. We publish over 7,000 multilingual messages on ethnic and social media, reaching over 130,000 community members.
We delivered 66,000 vaccinations at community-based clinics, with a higher uptake from overseas-born and Medicare-ineligible patients. We have learnt best practice for leading a dynamic, co-designed response with our local community partners, ensuring our health service provision was culturally relevant, trusted and accessible by our diverse communities.
Our major goal during the pandemic was to help protect our culturally diverse community with timely, up-to-date and relevant information. Traditional communications methods were failing to reach these groups at a really critical time. We needed to counter misleading information on social media.
Our work was shaped by the interaction with called and cultural groups, councils, police, the Emergency Operations Centre and other teams in the district. The feedback we received helped us to develop more than 225 social media videos in language and in English, involving 130 trusted culturally diverse staff, GPs and community members.
We introduced new practices, distribution channels and most importantly we produced specially targeted communications in a range of languages.
We developed new networks to distribute our videos and material to ensure our core communities were kept informed of the evolving situation and vaccination. We worked very closely with our multicultural services and health promotions teams who helped us to ensure our communications were reaching our called audiences.
During the COVID-19 pandemic, challenges and changes to the way we live, work and socialise with others were amplified, and even more so in Western Sydney. The Healthy at Home tip sheet was a one-stop shop for practical, timely, relevant, health-literate information during lockdown. It provided information our community told us they needed, such as where to find culturally appropriate fresh food, how to keep active in small spaces, mental well-being support and emergency contacts.
We work collaboratively with many partners, including contact tracers, the translation services and Multicultural Health Unit. We were speaking directly with the community through this once-in-a-lifetime horrendous situation that the whole world was facing, but here in Western Sydney, a lot of those issues were amplified because they were in lockdown and it was a really, really challenging time.
The tip sheet, available in 17 languages, was embedded into emails for people with COVID-19 and their close contacts. It was also housed on our website and shared broadly by partners. Hard copies were distributed in food packs to thousands of households by Resilience New South Wales and to Department of Communities and Justice housing residents.
We all lived through COVID, but we didn't all have the same experience. We learnt that a one-size communications approach does not fit all. To reach people most in need, we must listen and work with our communities and tailor our communications accordingly.
So a huge congratulations once again to our three magnificent finalists. You and your team should be very, very proud of the great work keeping our community safe during the very challenging time of this global pandemic that we're still living with. I'd like to now pass on to Susan to announce the winner.
Thank you. Again, congratulations to all of the finalists. Truly wonderful work, and you should all be exceptionally proud of the efforts that you made. Some of those images certainly bring back some post-traumatic stress disorder, those vaccine clinic lines. Yeah, it was a time. It was a time.
And can I just butt in and say, Susan, before you announce the winner,
yes,
we need a drum roll.
We need a drum roll. We definitely need a drum roll. Off you go. That's quite good. The winner of the pandemic response COVID-19 is South Western Sydney Local Health District.
Okay, thank you so much and welcome. Thank you. I'm a little distracted here, but congratulations. That is thoroughly well deserved. I've actually got, the reason why this is ringing is because, and I'm so sorry to take away from the grandeur of this, but this person here, security's calling this phone. It's a Subaru Forester. Oh dear, you're in big trouble. Unfortunately, it's blocking the road, so it's quite urgent that you move your car. I'm so sorry. Thank you. All right.
So long as the drum roll can continue.
Yes. So moving along, but thank you and congratulations to you on that magnificent win. Well done. Yeah, congratulations once again to the South Western Sydney Local Health District Strategic Communications and Media for your awards. But now I would like to request the Sydney Local Health District representatives to come to the stage to receive your well-deserved finalist certificates. And I'd like to now request the team from Western Sydney Local Health District to the stage for your finalist certificate. Well done. Fantastic. Well, congratulations once again to our winners, to the finalists of the pandemic response category. We really, really, truly appreciate all of your efforts the past year and more. Moving on to our next category, transforming the patient experience. For this year, we have one finalist in this category, which is the South Eastern Sydney Local Health District, for using WeChat and Line to reach vulnerable populations. So let's watch the finalist video and find out more about the work they've done.
In 2021, Sydney Sexual Health Centre created WeChat and a Line account. This will allow us to communicate with Chinese and Thai speaker sex workers. We developed the project because we received requests from the multicultural sex workers who use these apps.
Multicultural consumers can face barriers to service access like extended phone wait times. Using WeChat and Line has enhanced service access and enhanced patient-centered care. It also reduces the need to book an interpreter.
Some common questions consumers ask us are, what kind of service do you provide? And can you share your location and book an appointment for me, please?
We use WeChat and Line to promote information about clinic times. It helps us promote our services and health promotion resources.
We found that this platform will quickly become popular with our priority populations. This platform are now average up to 200 information requests a month.
It is also used to support contact tracing and finding clients lost for us to follow up.
Because of these apps, we now have a bigger attendance at sexual health clinic.
This project has helped service users in so many ways.
Okay, I know there's a little bit of a spoiler alert with this award winner, but nevertheless, drum roll, and then I'll hand it to Susan. Thank you.
Well done. Well done to the team.
Well done once again to the South Eastern Sydney Local Health District for your award. Congratulations once again. We really appreciate your work. We now move on to the individual awards. So the next category is the Staff Member of the Year Award, and the three finalists are... Well, let's start with the first finalist. It's Ashley Young from Hunter, New England Local Health District. Congratulations, Ashley. Our second finalist is Nelma Gallas from Western Sydney Local Health District. Nelma, welcome. Very popular nominee today. Our third finalist for this category is Fawzia Hamdard, who's also from Western Sydney Local Health District. And again, you know the routine as we're watching the videos of the finalists. If you're lucky enough to have been nominated, our three finalists, make your way to this side of the stage, and then when you get your certificates and your awards, move to the front of the stage so we can get a nice, clear photo of you. That would be fantastic. So let's have a look at their wonderful work.
I'm extremely fortunate that our workforce of refugee health nurses, liaison officers, interpreters and admin are known and trusted throughout the communities in our region. When COVID came to Newcastle last year, months after the Sydney outbreak had started, it was in multicultural communities. Working closely with Population Health, we created a cultural support program modelled off the innovative Hunter New England Aboriginal Cultural Support Program. This aligned a cultural support worker directly with individuals and families, supporting them through the challenging initial stages of our outbreak and of their disease progression. We also initiated community Zoom information sessions in many languages and English in partnership with Newcastle Police, Northern Settlement Services, STARTS and Hunter Multicultural Communities, where experts would provide updates and support and a place for any question to be asked. As a result, our region experienced a significant drop in infection rates amongst multicultural communities after the initial highs. And in comparison to other areas, we saw fewer police infringements and very high vaccination rates amongst all multicultural communities. This all came down to the approaches and the hard work by all involved in Hunter New England.
As maternity liaison officer, I bridge the gap between the healthcare system and CALD women to provide language-specific, understandable information pregnancy and newborn health. I run in-language antenatal education classes and provide one-to-one information to CALD women at the Women's Health Clinic, where I have supported over 20,000 women with the assistance of an interpreter over the last 2 decades. This has also been in conjunction with the use of Western Sydney Local Health District, Multicultural Health Service, and the Multicultural Communication Service. I provide pregnancy-related material that is also available on our website in language-specific material. For example, our Having a Baby resource in dairy and safer baby information, dairy to name a few. During the pandemic between March 2020, December 2021, I was also able to send translated material via email, SMS, and through the website who may have otherwise missed out on information. I am thankful and grateful to be an Australian and proud to be a part of a wonderful workforce which supports vulnerable communities like mine.
I'm the Afghan and Emerging Communities Multicultural Health Program Officer at Western Sydney Local Health District. My team and I are very committed to helping the Afghan continue to understand COVID-19. During COVID-19, I was involved in the development of various multilingual health resources. We identified gaps that the Afghan communities had in understanding and managing various aspects of COVID-19, included contact tracing, use of QR codes, and understanding isolation rules. We advocated for resources to be developed in Hazaragi and Dari to reach vulnerable community members. Our team partnered with agencies including Environmental Health and starts on the project to educate Afghan business owners to understand various restrictions. I had ongoing contact to them to understand with regulations. In my role, I have helped provide vaccine education and assistance with booking to more than 900 Afghan community members, including newly arrived Afghans. It's important that we continue to run bilingual education sessions to Afghan communities on COVID-19 and other health-related topics to help them be informed to stay healthy for themselves and their families.
So, some truly amazing finalists there, as you can see, for Staff Member of the Year. But it's time for the drum roll.
Do you know, just for context, we've got somewhere between 160 and 170,000 staff in New South Wales Health. So to be recognised as finalists, it's pretty amazing. So big round of applause. Staff Member of the Year for 2022 is Nelma Gallas.
Well, a huge congratulations to Nelma Gallas from the Western Sydney Local Health District for that wonderful, wonderful award. I'd like to now invite to the stage Ashley Young to receive your certificate, a very, very well-deserved finalist certificate. Well done, Ashley. Thanks and congrats once again to Ashley. I know how hard you and your colleagues in the Hunter region are working, so congratulations, Ashley. Well done. I'd like to now request Fauzia Hamdard to come to the stage. Oh, she's already here, sorry. Congratulations to Fauzia for your certificate. Well done to Fauzia and indeed to all of our finalists. Now, the final category for the 2022 Multicultural Health Communication Awards is the Consumer Community Representative of the Year. There are 2 finalists. Firstly, Nyan Tit Tiu, nominated by Cancer Institute New South Wales. Our second finalist is Masuda Khan, nominated by South Eastern Sydney Local Health District. And while we're watching the videos, as always, please make your way here to the left of the stage as we check out these videos showcasing the hard work that's been done.
It played such an important role in the development of the 5th Cancer Plan and is one of 3 consumer and community members on the New South Wales Cancer Plan Governance Committee, which provides strategic direction and oversight of the statewide cancer control plan.
As a cancer survivor and consumer, I do what I do to support my multicultural sisters who are or have been through a cancer journey. Through my cancer experience, I realized that my multicultural sisters do have many barriers such as language and cultural issues and also poor health literacy. Because of this, the majority of them are not accessing a good many cancer services that are available for their health, well-being and survivorship.
FIT's community networks and passion was so important in the early stages of the development of the Cancer Plan. Her ability to connect with multicultural communities enabled us to include a powerful consumer story from a person who does not speak English and helped bring many stakeholders together for the co-design workshops.
For me, this is a major access and equity issue, and I felt that something needs to be done. That is why I found the Sisters Cancer Support Group in 2014. We help the multicultural women by giving them direct support and also by advocating on behalf of them. I am so passionate about this that I promise God that I will commit the rest of my life on this cause.
Masuda has been a consumer representative with the South Eastern Sydney Local Health District's Women's Health Program since 2017. She worked with our program to design culturally appropriate resources that promote cervical cancer screening for women from the Bangladeshi community. Masuda is a champion for cervical screening in her community, and because of her, women are now more confident to see a health professional for important cancer screening that could save their lives.
As a community worker and a consumer, I support my community a lot who have been through cancer. There are specific barriers for my community, including low awareness of available health services, settling in a new country, language barriers, belief around cancer, and stigma associated with cancer.
Masuda has also helped the Bangladeshi community to better understand COVID-19 and to get vaccinated.
I have used my localized knowledge about the health system and community connection to help community members to overcome some of the barriers associated with cancer screening, COVID-19 vaccination, and flu. It is important that everyone in my Bangladeshi community understand that seeing their doctor for a cancer screening test will help them stay healthy.
So congratulations to two very well-deserved finalists. But it's time to announce the winner.
Well, the judging panel obviously had a difficult time with this one, ladies. So I'm delighted to announce that you're both winners.
How very wonderful. Congratulations once again to Nyan Thit Thieu for winning the Consumer Community Representative of the Year, to Cancer Institute New South Wales for nominating you as well. And a big thank you to and congratulations to Masuda Khan, nominated by South Eastern Sydney Local Health District. Congratulations to you for also winning the Consumer Community Representative of the Year category. We also acknowledge the South Eastern Sydney Local Health District for nominating you for this very prestigious award. I'd like to now invite all of our winners to the stage for a group photo with Ms. Susan Pearce, Ms. Lisa Woodland and Mr. Toby Wilson, because this is an incredible lineup of finalists who all deserve our congratulations. Thank you all again for your wonderful work, but we do want to get a photograph of you all. So all the finalists, all the winners and finalists to the stage, please. Okay, now before you go too far away, can I get the winners, please? The winners to come to the stage for another photograph. Thank you so much. Thanks to our winners today. We're not done with the photographs yet. That's it, yeah. Wonderful, thank you. Thank you so much, friends. Thank you, everyone. Really appreciate your excitement and enthusiasm. Well done to our winners. Obviously, very popular people in the room today. Just while I've got your attention, if you do want to get photos, of course we encourage that, we welcome that, but I am told that after the event, when it wraps up soon, you'll have an opportunity outside. There is a lovely area set aside for you to take more photographs. So we'd appreciate, once the event wraps up, if everyone could move out relatively quickly, just to help the staff here, and then you will get time to take more photographs outside. But now it's time to acknowledge the incredible work and commitment of our impressive panel of judges for this, the 2022 Multicultural Health Communication Awards. The judges had an incredible time and quite a challenging time of culling the application. So if I can just ask for your attention to give these people who've worked so hard their due recognition. So we appreciate if you can direct your attention to the stage for that. These people had the huge task of culling the applications, identifying the finalists, and then finally, of course, choosing our winners. So I'd like to call to the stage judges to receive certificates of appreciation from Susan and Toby. So we'll start with Amanda Stephenson, Director, Public Health, COVID Communications, New South Wales, Ministry of Health. Also, Ashley Young, Manager, Multicultural Refugee Health, New South Wales Health Service, Hunter, New England Local Health District. Well done to Ashley. Ashley, well done and congratulations. I'd like to welcome to the stage Dana Moard, Program Lead, Western Sydney Local Health District Strategic Partnerships and Programs. Okay, Dana can't make it today, but congratulations to her. Appreciate her hard work. Nadia Bakarian, Head of Business Development from the mighty SBS in language. Well done, Nadia. Congratulations, Nadia, well done. And Sue Advani, Community Representative and President of SEVA, S-E-V-A, SEVA International. Well done to Sue. And just a photo of all of our judges would be terrific. Well done, well done. Thank you so much to everyone. Thanks to Susan, Toby, and also to Lisa, of course, for your help with the handing out our amazing awards. Special thanks again to the Secretary, Susan Pearce. Thank you so much for being here today. What a pleasure it was, and an honour to have you join us this morning. Congratulations once again to all of our winners and finalists for your passion and dedication. We also want to congratulate all the individuals and organisations who took the time and effort to submit their applications, of course, for these awards this year. I have already done so, but why not? Another big shout out to Susan Pearce. Thank you so much for presenting the award winners with their certificates. Toby Wilson, Lisa Woodland for being with us today. Now friends, all the videos that you've seen today and the recording of this awards presentation will be available by downloading and visiting Multicultural Health Communication Service website. That is at all the W's, MHCS Health. So, sorry, it's www.mhcs.health.newsouthwales.gov.au. Links will also be shared through the MHCS Facebook, Twitter, Instagram and LinkedIn pages, so you should be able to find it pretty easily. We'd love you to take photos once again, but I do remind you that we'll be doing so out the doors. There's a beautiful area there that you can keep snapping away. And you can also scan the QR code on the screen. There it is. There it is. That's going to take you directly to the Multicultural Health Communication Awards webpage. That's where you're going to access all the videos, resources, photographs showcased here today. We also invite you, of course, to visit Multicultural Health Communication Service social media channels. A reminder again of that hashtag Multicultural Health Awards. The New South Wales Multicultural Health Communication Service would like to thank the Office of the Minister for Health, Secretary, New South Wales Health, Susan Pearce and her team, the New South Wales Ministry of Health teams, the Multicultural Health Services right across the local health districts for their continuous support of Multicultural Health Communications Awards. Without you, we wouldn't be here today, so we do thank you so much. Huge congrats and gratitude to everyone who's joined us here today at this magnificent New South Wales State Library. For everyone online, thank you so much for joining us for this very, very special event. I'd like to extend a very big thank you to the New South Wales Multicultural Health Communication team, the Health Service team, for their ongoing exemplary work in showcasing outstanding multilingual health resources, innovative programs, extraordinary initiative that address the health needs of our culturally and linguistically diverse communities here in this magnificent state. And I'd finally like to ask Susan, Lisa, Toby, Oriana, Uncle Alan in his absence. But anyway, everyone who's joined us as VIPs, we need more photos, okay? Can you please make your way to the front of the stage? But that's where we'll be wrapping up proceedings for today. I'm Janice Peterson. I'd love to see you, SBS World News, every weeknight, 6:30. But we'll leave you with the very, very colourful sounds of the cultural arts Collective. I hope that fine wasn't too big. Maybe talk to Oriana. I don't know if she's going to sort you out, but I hope all that worked out. The Cultural Arts Collective, thank you so much for your entertainment throughout the day. Haven't they been great? That is so fantastic. Well, what can I say? Enjoy the celebrations. Congratulations to everyone. We shall see you next year. Stay safe.